Hello, everyone, and welcome back to Andy's YouTube Food Skepticisms. Today is Saturday, January 25th, 2020, and today's topic is fibromyalgia. You're wondering what the heck is that? Well, we're going to get to that. Here's an overview of some of the topics we're going to discuss today. First, we're going to talk about the commonality or prevalence of fibromyalgia. Then we're going to talk about some of the common signs and symptoms that a person with it might have. Thirdly, we'll be talking about the cause or etiology as we refer to it. Four, risk factors or things that increase your risk of developing fibromyalgia, according to science. Sometimes there are associations, but sometimes they actually increase the risk as a direct cause. Five, treatment. This includes standard medical treatment with a little brush up on the nutrition. I summarize it. But then on number six, I get right to nutrition therapy and discuss what general guidelines would be. Seven, I give you a bunch of cool resources that I've sort of culled over the years and I found during the research for this. Eight, I give you a list of takeaways. And I really hope by the end of this, you like it. Actually, maybe you love it. And you subscribe. So hit the like and subscribe button. I'd appreciate it. For those of you fellow nerds out there, I got some references. And of course, as always, I thank you. And there, please leave comments and questions down below. So, prevalence. Approximately 5 million people have fibromyalgia, which is not really a large number when you consider that the population of the United States is approaching 300 million. But approximately that's 2% of the US population, as you might imagine. And here's the thing. For a long time, fibromyalgia really wasn't a thing that was discussed a whole lot by non-scientists. It was stigmatized. People said, it could be laziness, it could be all sorts of character problems. And it wasn't until science exposed it that we realized this is a real thing. There is no known cause, as we'll come to find out, and they certainly didn't have a good idea of it in the old days, so they just dismissed it, a lot of people, and they just said it's in the head, which we will come to find out it can affect the head, but it's not all in the head. Anyway, next we're going to talk about debilitating comorbidities, and I should just add a little asterisk to my statement about it's in the head. I don't mean to suggest at all that it's partly psychological. What I mean is that people who have fibromyalgia, as we'll come to find out, are affected more highly by depression, which is thought to be caused by the debilitating disease itself. Sort of like how people with cancer end up having higher rates of depression. So, some signs and symptoms. We're looking at increased sensitivity to pain, heat, light, and sound. Makes sense, right? Because we'll see down the line here, it causes headaches. It's characterized by persistent muscle pain, and we'll talk about what we mean by persistent. Stiffness in the joints, but no inflammation, though. No apparent swelling, which is really odd. Often comorbid depression, as I just mentioned, and autoimmune disease. So people with autoimmune diseases are more likely to have fibromyalgia as well. We're not sure what the connection is exactly, but there's some connection. Also, people with fibromyalgia are affected by something called fibrofog, which means poor sleep and memory. They may have increased somatization, which is defined as anxiety in the anticipation of pain or discomfort. So that makes things more stressful. And people who've had it often describe it as like a bad case of the flu, which sounds absolutely terrible, like a flu that never goes away. I don't know about you, but that sounds like one of the worst things that you could have from like a pain standpoint. Anyway, maybe I just had man flu once or twice, but to me, that feeling like you've had the flu is pretty bad. Now, oftentimes it should be said that the signs and symptoms are mistaken for non-celiac gluten sensitivity or NCGS, and I will talk about that in a later slide. But anyway, just know that it's often mistaken. It's very hard to diagnose it, in part because it's hard to rule out other causes and narrow it down to fibromyalgia specifically, which is a differential diagnosis, as we call it. According to the American College of Rheumatology, 3 or more months of otherwise inexplicable muscle pain would be scored on a symptom severity score, and that's one of the criteria for diagnosis. The other one is that you have pain in at least 11 or more of the 18, some sources say 19, tender points in the body. And that's also rated on something called the Widespread Pain Index, WPI number. Now, no blood tests or x-rays can actually diagnose fibromyalgia. In fact, blood tests don't really do a fantastic job of hinting at fibromyalgia. So often these other criteria really takes the cake. And like I said, there's no joint swelling, unlike arthritis. So that's why you don't have any x-ray evidence of it. I mean, you see on an x-ray evidence of osteoarthritis in older people and such. Stands to reason you should see it if it's present in fibromyalgia, but there's no evidence that there is. The cause, or etiology, is unknown. Now, if it's unknown cause, we refer to it as an idiopathic disorder or disease. Idiopathic basically just means, well, how could you say this? Without like a pathology without origin or thought. Thought to be genetic with activating environmental factors. So basically, you have a genetic predisposition to it, and whatever environmental factors you encounter growing up and whatnot seem to turn on or enable certain genes and the expression of them, possibly. That's the best explanation I've come across. Anyway, what some of those environmental factors might be varies, but a few of the popular hypotheses and theories are virus infection, a history of childhood abuse, particularly sexual and physical abuse, and trauma. And that includes physical trauma, of course, but also psychological, so many people with fibromyalgia may also be suffering with disorders like PTSD, and that's something to keep in mind. Higher rate of comorbid autoimmune diseases, right? We mentioned this before. It's kind of odd to think about it, but perhaps down the line we'll be referring to fibromyalgia alongside the likes of type 1 diabetes or juvenile diabetes as it used to be referred to. There's a reason for that change. But also other disorders like Hashimoto's thyroiditis and other ones. These are all autoimmune, and it would be probably a relief to people suffering with fibromyalgia for it to be recognized as such. So, risk factors for developing fibromyalgia. What's going to increase our risk? Well, sorry, women, but just being women increases your likelihood by twice as much. It seems like kind of sexist. Anyway, if you're middle-aged or greater, that will increase your risk. Those with a family history, that's one of the reasons we suspect a genetic connection. If you're overweight or obese, and you have other comorbid diseases, like we talked about autoimmune diseases, but another one should be mentioned that endometriosis is something that occurs often alongside fibromyalgia. And for those who are not in the know, endometriosis is characterized by overgrown uterus tissue, and it's often accompanied by pain. So, bad news bears. I do not envy people with endometriosis. I don't have an endometrium. So, privilege? Anyway, history of childhood abuse. Cannot be stressed enough. There's a strong link here between childhood psychological trauma and fibromyalgia's development. So, treatment. First things first, patient education. Must know about fibromyalgia, must research it more, must inoculate yourself against misinformation. The best way to do that is to read good sources, like starting with this. Maybe I'm tooting my own horn, but I think I'm a good source. Anyway, other things that entail in the treatment are medications for pain management. Popular ones for that include duloxetine, also brand name Cymbalta, pregabalin, which is Lyrica, and even over-the-counter meds like ibuprofen or Tylenol. Ibuprofen in particular, because it's what's called a non-steroidal anti-inflammatory drug. And while there does not appear to be any joint swelling, I would not be surprised if inflammation was implicated in this somehow, as inflammation is behind a lot of things. And one thing's for sure, if you have clinical depression alongside fibromyalgia, odds are that you probably have some sort of low-grade systemic inflammation, which is characteristic of clinical depression in patients' brains. It is medical marijuana approved in the state of Pennsylvania and possibly generally. It's classified as a central nervous system type of neuropathy. So your chances are really good of getting approved for that to help with pain management. You also want to, as part of treatment, focus on relaxation techniques to help. And meditation or yoga, which is kind of like a moving meditation with exercise, um, really helps to hone the brain and assists other therapies, which we'll talk about, like cognitive behavioral therapy and exercise and such. It sort of helps to handle thoughts better and to train your brain to handle thoughts better because they're often random and damaging. Another thing to try is what's called progressive relaxation and or visualization. If you're not really aware, visualization is obviously trying to incorporate all your senses, sight, smell, touch, things like that, in the imagining that you're experiencing something else, like maybe a different scenery, or maybe a feeling of accomplishment or something like that. It's a very powerful tool because it takes advantage of the brain's sort of future bias, and believe that's a very powerful tool. Um, Also, in addition to that progressive relaxation, basically what that entails is, say you're lying down in bed or sitting in a chair or such, and you focus on particular muscle groups or body parts, like, for example, an ankle or your toes, and you systematically and progressively uh, tense those muscles and then release the tension consciously. And if you repeat that cycle, or going through the whole body and their body parts systematically, it really does help. I have zonked out like I have never slept before using progressive relaxation. It's really been a lifesaver for me with PTSD. So I imagine it would be with somebody who has fibromyalgia. Going on, you want to get physical exercise. Now, because we know there's no joint inflammation or anything as far as we know associated with it, but there is pain. So it was hypothesized early on that perhaps the pain would cause the physical exercise to be damaging. What we've actually come to find out is that there's no increased risk of injury for people with fibromyalgia exercising. Their biggest hurdle seems to be dealing with the fatigue and looking past and working through the pain, which are all very, very challenging, and that's why I suggest people seek medical treatment for that. Group support. I cannot emphasize this enough. Because in the case of fibromyalgia, we talked about how sort of rare it is and how unlikely people with fibromyalgia are to run into each other and form tight bonds. It just so happens that they're too scattered across society, and many people don't even take it seriously. So, other people finding other people, oftentimes it gets stigmatized and people avoid the conversation topic. But you should seek out good group support like online message boards and community. There's a lot of wisdom in groups, as well as a lot of foolishness sometimes, but often what you'll find is that a person has been in a similar relationship, like, you know, maybe a lot of stressed interaction between fellow family members or something about how they perceive fibromyalgia and do they think it's real, whatever. So Seeking group support is one way to gain wisdom and experience in this matter kind of vicariously and to incorporate it into your own mind so you can handle things better. You can live your life with more quality. Going on nutrition interventions, which we will discuss in the next slide. I'm really excited about that because that's my specialty. Um, it needs to be said with this treatment slide that following this treatment comprehensively, not just the nutrition, but the medications or the medical marijuana specifically, or relaxation techniques, exercise, group support, all that, those who follow those, 60% of them report reduced symptoms. So if that's not effective enough for you, I don't really know what to tell you. You got to understand that that's more than just, say, placebo effect. That's more than just psychological because, uh, we know from tests that antidepressants like SSRIs are often not much more effective than exercise, which seems to be the most effective. And there are side effects, and people often look at that stuff and go, well, um, it's the antidepressant doing all the work. But I think the effectiveness rates of many of those are like approximately 20% in that range. So I wouldn't get too hyped about just sticking with one method here. I want you to spread your eggs in a wide basket. And I really want you to start accepting your limitations. Like I said, this is a real thing. It's not your fault, but you have to deal with it unless you decide to check out, and nobody wants that. So if you're here to stay and you're going to deal with your ailment that you've inherited, progress slowly. Be kind to yourself. Like, really, take care of yourself. Like, sometimes the laundry can wait an extra day, but you need to take care of yourself in the meantime. You need to take care of your responsibilities and prioritize. So, prioritize yourself. Nutrition therapy. All right, this is the good one. So fibromyalgia often detracts from self-care. It's the fatigue, it's the pain, it's everything. It takes people's mind from self-care. It's a big distraction, it's a big anxiety to deal with. And nutrition often gets affected with this as well. And we know that good nutrition habits may reduce pain just by themselves. So some of the nutrition therapy, what it calls for in the guidelines is that you focus on good eating habits generally. So that means keeping a food journal if you have irritable bowel symptoms, like a sudden urge to go to the bathroom all the time. Do meal prep on your good days. That way on your bad days you can focus on self-care and getting back to speed. Consume multiple smaller meals for more sustainable energy. Part of this reason is that you're not consuming such a large meal with such a big hit on your blood sugar. Therefore, you don't sustain the spike that you would with as with large meals if you do smaller meals. So it's more spread, more sustainable. You don't have those energy dips waiting for your next meal. It's just constant, easy breezy flow. You want to avoid caffeine and alcohol before bed. Now, a lot of people will see caffeine, well, that's a no-brainer, but why alcohol? Isn't it grandpa's old cough medicine? Isn't it grandma's old nighttime ritual? There's a lot to be said about the power of alcohol to make us feel like we're being more relaxed. But what we found from brain studies is that alcohol, even in small amounts, interferes with the quality of sleep and the types of sleep cycles we enter and sustain while we're asleep. So your restfulness on alcohol is going to be a lot less. And we want you to be rested. We want you to make the most of your energy. One good trick is to consume a high starch snack right before you go to bed. I mean, have some oatmeal, have a little bit of cereal, something like that. You don't have to eat a large snack, like just a little bit of snack. And that way, you can lay down and you don't have acid reflux or anything, but then consider it. It really works. I've tried it. Um, Now, here I've got to point out that supplements are not recommended. Now, by that I mean like anything more than like a Centrum or a one a day. I'm talking about those GNC mega vitamins. I'm talking about those supplements that are like 8,000% of your daily value that they sell separately at the Walmart or whatever. Avoid those. Just go with the Centrum or the one a day. They'll cover everything you need. You only need 100%. And you'll avoid a contraindication, a medical contraindication. That means a warning sign that you shouldn't use it. And that warning sign is that fibromyalgia is accompanied by an imbalance of metal ions and vitamins in the body. That's according to some evidence that we have. So you may be aggravating it by contributing more and more vitamins and minerals than you would get from your normal diet or a simple one a day or Centrum. So by the way, feel free to go with like off-brand generic forms or like Walmart forms or Target forms or whatever of these of your Centrums or your one a days. You don't have to consume the brand name; they're virtually identical. So, and you'll save a lot of money, pennies a day for a little bit of insurance. Anyway, here are some resources that I want to discuss with you. Medline is basically a medical encyclopedia, the best, the best. I love them. You can find so much high quality information on there on just about any topic medically related. Way better than WebMD, hands down. The next one is the Arthritis Foundation at arthritis.org/diseases/fibromyalgia. They have a lot of content. You would think, well, it's not arthritis. Why are we doing this? Well, because of joint stiffness. It's often lumped under the responsibility of all these arthritis foundations as well as your rheumatologists. And rheumatologists are basically your arthritis doctors and specialists. So, you know, your guess is as good as mine, but they just sort of arbitrarily got assigned with it, and they seem to be doing a fantastic job. So, go rheumatologists. Cochrane reviews. So if you watch my previous video on trying to compare nutrition sources on the internet, you will see that we consider a meta-analysis, which is like a study of other scientific studies, a review of them, a collection of them, and the processing of all those studies using advanced mathematics to come up with larger sample sizes, experimental groups, to get more accurate information. And multiple studies, not just one, replicated studies, not just individual ones. So Cochrane Reviews is your best source for that, in my opinion. They are so easy to search, and I did it for fibromyalgia and find so many things. So please use the link I've got there. And lastly, peer-reviewed scientific studies. They're always the best. They're great. Problem is, a lot of them you have to pay for. So what I did here is I gathered up some PubMed resources that were really good, published studies that are peer-reviewed, and they're very high quality, and they give you a taste. And I like things in threes, so that's why you've got three of them. 5 key takeaways. Fibromyalgia is not just in the head, but it can affect the head. It can affect your mental health. And not only that, but sure as hell, stigma can. So if you're the kind of person who didn't believe before this started that fibromyalgia was real, I hope you're a little bit more convinced now or that you do your homework, because people with fibromyalgia need our support. They need our help. It's extremely debilitating. It's a very, very common source of disability, right along there with the depression that also comes along with it. So it's not a laziness thing. It's not something people can control. The best they can do is manage it. So support them in their recovery. We know that fibromyalgia may have a part genetic, part environmental cause. So don't blame yourself for everything. Genetics is probably part of it, and you'll have to do a lot of blaming with some ancestors that are long since dead, and that just seems like a futile conversation. So don't get worked up about it. Lastly, do self-care, including nutrition, to reduce your symptoms. That includes getting medical treatment from a rheumatologist, preferably, because most family physicians don't encounter it very often. So they're not, oftentimes it can be lesser priority in terms of what to study when you've got off hours or when you're on the job. So rheumatologists, they're specialists, they'll know what to do, for sure. And read about the science. I say see the resources page and really get immersed in it. It will inoculate you against internet BS. That's always good. So please click like and subscribe if you indeed like this and you want to subscribe. Do it today. Don't wait. Time is now. The future is not guaranteed, yada yada. And you want to die knowing that you liked and subscribed my post. Trust me on that one. I'd be willing to put it on the epitaph. I'm that confident in that statement. So please like and subscribe. I love you. References pretty much all contained within the slides. And as always, please, please, please add comments, including suggestions in the comments section and questions there. I'm very good about responding to direct questions, or I will tell you when an upcoming video is about to address something. And if you tell me about a subject that interests you, guess what? I guarantee it, 99.9%, it's going to end up a topic in some form or the other. So get involved, get engaged, and I will engage you back.